इंडियन सोसाइटी ऑफ क्रिटिकल केयर मेडिसिन की तरफ से एक प्रेस कॉन्फ्रेंस का आयोजन आईटीसी रॉयल में 2 मार्च को रखा गया। आइए हमारे चैनल के माध्यम से देखते हैं प्रेस कॉन्फ्रेंस कैसा रहा।
For a longer than usual period, then the next patient who comes onto this bed may not respond to that antibiotic, leaving aside so many other collateral damages that are more technical in nature, which I will not speak about. But what are probably harming is the next patient who is to come onto the same bed, he may not respond to the same antibiotic that the first patient did. And you media, because I don't know, because of sudden increase in nation pride, they take a lot of flack when a study like Lancet study is published, but the common public as well, and in general increasing the level of.
Thank you. Thinking the problem. First and is what is called a One Health concept. I think it's important for you to disseminate this. It's not only the use of antibiotics by the doctors to the patient, but the use of antibiotics in agriculture. You see, antibiotic sprays are being done in agriculture, in farm houses, so that the plants are not destroyed by the different kind of bugs. Same with the animal husbandry. You see, antibiotics are used in poultries and many other animal husbandry as a growth promoter. And as you know, there are many industry factories manufacturing drugs. The effluent of those factories go into the rivers, and they also have antibiotic residuals. So this is called One Health concept. The food that we are eating has antibiotic. You see, a person who has never been exposed to an antibiotic, it has been found they can get an infection due to an antibiotic resistance. So how can he get an infection due to antibiotic? He is not taken antibiotic. So even young kids, I remember a young kid has come, 13-year-old, never had antibiotic in his life with appendicitis, and his infection was due to a drug-resistant infection. So it must be the antibiotic that he has consumed in a food has given rise to resistance. And how did he got that antibiotic? That must have been used while manufacturing the food products. So I think that is what is called One Health concept. We can't keep it in isolation, just prescription of antibiotic. And second, not only outpatient, inpatient, but as a whole antibiotic prescription. So that is one thing which needs to be looked into and needs to be disseminated, this knowledge. Vaccination, prevention of infection is as important. If you don't get an infection, you don't prescribe an antibiotic.
Yeah, so antibiotic has now become more like an anti-anxiety medicine. This is what has occurred. It's to get off anxiety of the doctor, maybe anxiety of the patient's relatives, and especially in pediatrics. Just discussing that when a child comes to the clinic, to an outpatient clinic, it becomes the parents do ask, why have you not prescribed an antibiotic? Now that is a fear, and the doctor also does not have, partly I would say the doctor also should have the patients to discuss the entire case and take that element of risk. So as time goes, we are going to get better. As point of care diagnostic जिसको बोलते हैं, in that place itself, if you can diagnose it's a viral illness, then maybe we can curb this prescription of antibiotics. So remember, this a while ago where there was no antibiotics, people were dying. Now we have millions of antibiotics and still no people are dying. So this has occurred because we have gone back to that condition where even if I fall on the ground and I have a scratch on my knee, I will probably require a very, very heavy dose of antibiotic. This is what is occurring as of now, and I'm shut up with that view that we will have nothing to save people. We are not to save people as time goes. We did a study in our hospital, okay? And what we did was we actually did cultures of stool specimens of people who were coming for normal things like an angiography or things like that, which is not infection, just an angiography. And we found a large amount of resistant organisms in those stool samples, which Todi sir was just talking about, that we found it in the community.
Alexander Fleming first identified penicillin. After that, we have enough antibiotic, one after another, and it's just like a water everywhere in the sea. but not a drop of water to drink. So we are going to have a situation where everywhere antibiotic, but there is no antibiotic is going to work. So we'll go back to pre-antibiotic era. The things are going in that way unless we, the stakeholder, and that includes Dr. Subra has mentioned that not the doctor only, everyone has got responsibility, including Dr. Subra's. Todi has highlighted that livestock, whatever is given to the animal, that could be the source of resistant antibiotic. So we have to be very careful. You know, what happens, antibiotic, we are scared because if my patient has got infection, if I don't treat it, might land up into sepsis. If sepsis, guidelines say, don't know what is the organism, give the best antibiotic, but that may not be the best for your patient. So you have to have some clinical background, what could be the organism, even the most cheapest antibiotics. Say for scrub typhus, we are getting scrub typhus with sepsis. Just doxycycline is a cheaper one, can cure, but we are giving meropenem, colistin and whatever. And that will cause the, what Dr. Shastri said, environment. The environment will, you will have a line up with colistin resistant, meropenem resistant in your unit, and subsequently one patient needs that and then it's not going to work. So it's everyone has to be very careful in choosing antibiotic, writing antibiotic, duration of antibiotic, dose, and dose has to be given in proper way, applying PKPD principle, that's the technical part. But what we are using, we have to be careful in every areas if we want to save antibiotic. Otherwise, we'll have everywhere water, nothing to drink.
Are talking about, and we need to talk to the people, is the One Health. My health is dependent on you. You all saw in the COVID that if one person is not well, we'll be able to have the spread. Same thing, we have animals at home, pets at home, other places at home. It's not only, there's also multiple things are there. So अगर आपको antibiotic resistance को देखना है today, the problem is that it's not only doctors, it's not only veterinarians. So people also have a responsibility to behave responsibly, and they must not take antibiotic just at the drop of hat. That is equally important. What we are talking is scientific, but we also have to have a behavior which is conducive with personal health as well as the public health. I think it's a public health message. It is not that simply it is critical care. This message has to go up. अगर हमको अपनी next generation को, as my colleagues, friends have talked about, देखना है कि the privileges which we had, it, longevity we have got, the modern medicine, the biggest gain, if we have to have it, we need to preserve it. And please realize that the data I am giving, and Dr. Todi and my colleagues will really, upper respiratory infections, that is the flu, or let's say your other infections, 66% data shows are overused in these cases. There is no need of it. वो बगैर प्रिस्क्रिप्शन के नहीं होती है. इसी तरह से एंटीबायोटिक्स के अंदर beside responsibility of the medical profession, veterinarians and also public health, there should be mandatory guideline कि no antibiotic like Kerala government has done it will be given without written prescription. उसमें उसको हमको रिकॉर्ड रखना पड़ेगा और उसके बाद उसको बता. अगर आज आप टीबी की कोई भी दवाई बेचते हैं तो उनको आपको निक्षय पोर्टल के ऊपर सरकार को बताना पड़ता है कि मैंने टीबी की दवाई दी है, रिपोर्टिंग है. इसी तरह से अभी एंटीबायोटिक का जो ओवर द काउंटर यूज है, इसको हमको बंद करना होगा.